We are back with more What's Now, turning our attention to healthcare, specifically veterans. How can we make sure that veterans are receiving the type of care that they need at the VA? Well, I spoke with two experts recently all about this. Let's take a look.
The American Society of Anesthesiologists is asking Americans to protect veterans. 91% of Americans say veterans receiving health care through the U.S. Department of Veterans Affairs, the VA, deserve the highest quality and standard of health care available. Joining us today to talk about this is Dr. Randall M. that's the president of the American Society of Anesthesiologists, as well as Dr. Rai, physician anesthesiologist, formerly with the VA. Thank you both of you for being here today.
Thank you.
Thank you for having us.
How does the VA propose to change anesthesia care, and what impact would that have on veterans?
There's a proposal currently in process to remove physician anesthesiologists from the operating rooms in the VA system and replace them with nurses. This proposal was considered back in 2016, and in 2017, the VA announced that that proposal would not go through for a variety of reasons, but including that their own analysis showed that it was not a safe change. We think that this change is unwise and unnecessary. We're asking the public to help us convince members of Congress and the VA itself to listen to their own VA experts, the anesthesiologists working in that system, and maintain physician oversight of anesthesia care in the VA.
How do people feel about the kind of care veterans should receive through the VA?
I'm going to let Dr. Rai tackle that one because he has the most experience.
The VA was designed to provide a level of care that's, the community in which it resides expects. So, for instance, in Denver, Colorado, the University of Colorado determines that level of care. And so, in terms of what they receive is a physician-led team of anesthesia providers to ensure the best possible outcomes after surgery. And those anesthesiologists have 12 to 14 years of training alongside surgeons, developing those pathways that they put into practice when they're taking care of you during surgery.
What is the difference between an anesthesiologist and a nurse anesthetist?
So that's the key difference right there. It's not just the amount of training, but what we're doing during our training. In medical school, we sit besides future surgeons, future cardiologists, pulmonologists, developing into a team that can care for you and ensure the best possible outcomes when you have surgery, either directly or indirectly. And so the anesthesiologist is a medical doctor who works with surgeons with the shared responsibility to ensure the best possible outcomes for you. A CRNA or a nurse anesthetist might have a lot of clinical experience in the operating room, administering medications, identifying physiologic changes, but not the medical background to take care of issues that are sometimes unpredictable and can be very threatening to patients.
What happened in 2017 when a similar change was proposed?
In 2016, the VA proposed a package of changes removing physician oversight from all 4 categories of advanced practice nurses that work in the VA system. After receiving over 200,000 public comments, the VA chose to continue physician oversight for nurse anesthetists. And as I think I mentioned before, their own analysis said that that was the right thing to do. We're hoping that a similar public outcry will keep the VA from making this unwise and unsafe change on this iteration.
And why did the VA decide to propose this change again?
So this particular change has been in process for more than a year. It's part of a program that the VA calls National Standards of Practice, and they're attempting to unify standards of practice across all types of medicine within the VA system. The wisdom of the VA's action in this is something that we're concerned about. We can save that discussion for another day. But again, nothing has changed since 2017 when the VA last considered this issue and chose the right path, which was maintaining physician oversight.
And how does the proposed changes in this anesthesia care compare to the anesthesia care available for most Americans?
We know that about 95% of the American population receives its anesthesia care in a manner where the anesthesiologist either personally provides the care or oversees the anesthesia care in an anesthesia care team mode. And so this is a radical departure from what most patients see in the United States and what every leading hospital in the United States uses as its anesthesia model.
Supporters of the change say it will help veterans gain access to care and save them money. And how do you respond to that?
Well, there really hasn't been an issue related to the availability of surgical and anesthesia care affecting access. And the way the VA bills the cost structure is a moot point. The key thing to remember here is, for instance, if one of your children or a family member is injured, you not only want them to get care quickly, you also want them to get the best possible care so you can limit how much suffering your loved one has, and also limit the amount of times they need to go back to either the procedure room, the emergency room, or be readmitted to the hospital. And that is very much true with anesthesia care as well. You want to make sure you get the best possible care your first go through so that you're not staying in the hospital any longer than you need to, taking away resources that other veterans can use.
And how can Americans help protect veterans' health and safety?
We're asking for everyone to go to the website safevacare.org. There is background information on this issue there, presenting clear facts about the differences between nurses and physicians. And there are links right at the top of the page that'll allow you to let your member of Congress know that this is an unsafe change for the nation's veterans. They really do deserve the highest standard of care, and we're hoping to roll back this proposal and maintain that high standard.
Well, thank you so much, Dr. Clark and Dr. Rai, for joining us today. Really appreciate this important discussion about helping veterans get the health care that they need. Thanks for your time today.
Thank you for
Christy.
having us.